Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within, just that day I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine.
I think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.